afternoon. I am presenting the effect of NDI of posterior capsular opacity on a AC depth and the refraction in the pseudophakic eye. Introduction part. The posterior capsular opacification of the secondary cataract is the most common long-term complication of modern extracapsular cataract surgery. The complication is as the decreased visual acuity, impaired contrast sensitivity, glare disabilities, and the monocular diplopia. The standard treatment of the PCO is ND-YAG laser posterior capsulotomy, which has success rate of more than 90%. The laser capsulotomy used as a quick pulse ND-YAG laser to apply a series of focus ablation in the posterior capsule and create a small circular opening in the visual axis. The primary goal of the study was to examine the influence of the ND-YAG laser capsulotomy on refraction and AC depth. The complication of the ND-YAG laser posterior capsulotomy is the retinal detachment, cystoid macular edema, raised in IOP, shift in the position of the implant. The protocol of this study was therefore to perform the ND-YAG laser capsulotomy after at least 3 months from the cataract surgery or at least 1 month after the intraocular inflammation had resolved. The inclusion criteria are the diagnosed case of glaucoma and steroid responder, corneal opacity, retinal diseases, uveitis, optic neuropathy, and surgery prior to ND-YAG laser capsulotomy. The methodology. This is the study. Study was a prospective and descriptive study. The declaration of Hansky and informed consent was taken from the patient before the intervention. Total 53 pseudophakic eye of the 43 patient with the PCO with the best characterized visual acuity is less than 6.9 were included in the studies. Only uncomplicated in small incision cataract surgery and phacoemulsification with the posterior chamber intraocular lens implanted surgery was included in the study. All the patients underwent ND-YAG laser capsulotomy from January 15, 24 to August 14, 24 in Rio RIMS. Patient was divided into two groups according to total energy used during the procedure. In group 1, the total energy exposure is less than 50 microjoule, and in group 2 more than 50 microjoule. All the patient underwent a complete ocular examination on all visit, including the VCBA, refraction, slit lamp biomicroscopy, IOP measurement, and OCT was used for the macular thickness. The IOL Master 500 were used to measure the AC depth. The combination of the topicamide 0.8% and the phenylephrine 5% was administered for pupil dilatation and prior to procedure. After the capsulotomy, a combination of the antibiotic and steroid were prescribed for 4 times daily for 7 days and anti-glaucoma drug 2 times for 7 days. They were examined pre-operatively and then 1 hour post-operatively and after 2 weeks after the capsulotomy. The result is 28 male and 15 female patients were enrolled in this study. 23 patients received total treatment in unilateral eye and 10 patients in both eyes. The table shows the divided into 2 groups. Group 1 is received total energy less than 50 microjoule and group 2 is received more than 50 microjoule. ND-YAG treated eye are the 32 in group 1 and 21 in group 2. The mean duration of surgery is 2.2 year in first group and second group 4.8 year. The table 2. The total energy exposed in group A is 26 plus minus 12 and group 2 is 81 plus minus 32. The spherical equivalent pre-treatment is minus 0.39 and in second group 0.4, minus 0.4. After the 1 hour of the treatment, the spherical equivalent is 0.5 and in group 2, in group 1 0.35 and group 2 is 0.36. After the 2 week of the post-treatment, the spherical equivalent is going to minus 0.34 and 0.37 in group 2. The AC depth of pre-treatment is 3.9 in group 1 and group 2 is 3.96. And after the 1 hour treatment, the AC depth goes 3.952 in group 1 and group 2 is 3.98. After the 2 week of post-treatment, the AC depth goes 3.97 in first group and 3.99 in second group. The comparison between the between two parameters are after the 1 hour treatment in group 1 Changes occur in 0.3 in 0.03 in group 1 and 0.03 in group 2. Almost is equal. AC depth.
Just take you can go to your last slide.
Okay.
Conclusion, yes.
The conclusion is base character visual acuity improved significantly after the NDAG laser posterior capsulotomy in healthy pseudophakic eye with PCO. There is usually no need to repeat refraction. AC depth 2 increases after the NDAG laser capsulotomy. This is my references. Thank you.
Just first of all, one simple question. This is a paper of cataract and refractive surgery basically. Why you choose in under the category of neuro?
Sir, it is taken by mistakenly, sir.
Yes. It is by mistake by
Yes,
that.
yes.
Okay. So ideally you can, I think, deprive because of this our error, system error. Okay. Anyway,
Thank you, sir.
it is not exactly in a
Yes, sir.
version, but
You have mentioned 2.9 AC depth, but you have shown 3.9 fast. Second, what is a descriptive study? Prospective, retrospective, cross-sectional, longitudinal. What is a descriptive study? These terms you should be careful because you are competing and you are postgraduate student. So these things you should remember. Okay.